So, Lyme disease and its effect on our health. So, what do you already know about Lyme disease? It's a disease from a bug, gives you a rash, and animals can get affected too. But did you know that's a lot more serious about? It's a lot more serious than that. That Lyme disease can give you irregular heart rhythms, severe migraines, neurological problems, and if a pregnant woman gets Lyme disease, she could then pass it on to the unborn child, and while not common, can have a stillbirth. So, what causes Lyme disease? Lyme disease is caused by a bacterium in the tick saliva. The tick bites you, and the saliva goes into your cells. Then it travels all around your body and it causes muscle and joint pains. So you're probably thinking, I already told you it came from a bug. But in reality, it comes from the saliva, not the bug. So this is a little bit what the bacterium look like. Kind of looks like one of those white little worms. So now that I've covered what Lyme disease is, how about I tell you how to avoid getting it? There is no vaccination for Lyme disease yet, but if you use insect repellent containing DEET, you are fully clothed, your chances of getting bit by a tick are very slim. Another thing to do to avoid this is to remove the tick if you see you have been bit. So let's talk about the proper way to remove a tick. You have to be very careful when removing a tick. Use fine-tipped tweezers to grasp the ticks as close to the skin surface as possible. Pull upward with steady, even pressure. Don't twist or jerk the tick. This can cause the mouth parts to break off and remain in the skin. If this happens, remove the mouth parts with tweezers. After removing the tick, thoroughly clean the bite area and your hands with rubbing alcohol, an iodine scrub, or soap and water. Dispose a live tick by submerging it in alcohol. Never crush a tick with your finger, because even if you think it's dead, there's nothing it can do. The saliva can still get onto your fingers and get transferred into your bloodstream. So after you've been bitten, what do? Make sure you present yourself to a hospital. At the hospital, they usually confirm you have the disease with symptom tests. As you can see, they usually give you a course of antibiotics for 2 to 4 weeks. The antibiotics have strange side effects. You would think, why would something that's supposed to help me make me sicker? That is because antibiotics work by killing the bacteria causing the infection or by stopping the bacteria from growing and multiplying. But antibiotics sometimes kill the good bacteria instead of the intruding bacteria.